I'm delighted that Southern New South Wales Health is adopting Elevate, and I just want to spend a couple of minutes giving you an introductory summary of what is Elevate, why are we doing it, what difference will it make. Elevate is the title that we are giving to Southern's adoption of the STUDA framework. Some of you will be well familiar with the STUDA work. In fact, we're now joining a family where many health services in New South Wales and around Australia, and in fact overseas, have been using this framework for some years. I've had the privilege of visiting many of those health services here and in the States, and also in my previous role in Victoria, I lived the STUDA framework, and it was central to the turnaround of our health service in terms of marked difference in staff engagement, clinician engagement, and patient satisfaction and safety. So I'm so excited that it's now Southern's turn to be bringing this implementation to life in our world. I love the clarity of the 9 principles that underpin this framework, as well as the raft of common sense tactics that bring alive the principles. And there'll be so much more information coming out to you all to give a sense of what that means in your part of our organisation. Our Director of Elevate has been specially appointed to support the implementation and the education across our district to bring the principles of Elevate alive in every workplace. Regardless of if you're running a family business or a school or a commercial organisation, or in our case, a big health service, there needs to be the rule book that describes how do we do things if we consistently want to nail the engagement of our staff and the satisfaction and safety of our patients. And so that's why we are implementing Elevate. So in terms of what difference will this make? Once we have successfully implemented Elevate, there will be measurable differences. Some of those differences include the measures of staff engagement. Others are around measures of clinician engagement and patient safety, patient outcomes, family confidence and community confidence. So the central measure at a personal level of the full implementation of the Elevate framework in Southern is that we would all be very confident that our most precious people would receive the right care every time in our health service. My vision for Southern New South Wales Health is that we are recognised leaders in rural healthcare, and our full implementation of Elevate is the journey book that's going to bring that vision alive.